People think they're delinquents because of the kind of things they do, but it's just the way they're responding to how the society has handled the feedback of their behavior.
Yes.
Ironically, children with ADHD are also very, very intelligent in class, completely high functioning. Most ADHD persons I've met, I think the nth person can take a liter of ice cream tumbler alone in a day. I don't know what's in ice cream. We're yet to get there. Then you find they start being shy. Then everybody is asking, that intelligent child,
What happened?
that child was a good performer. What changed? They get more quiet now. And you may have found children who talk with foreign accents to the oblivion of parents. They are like proud, my child can talk like an American, but it's not an interactive communication.
Welcome to Daktari Tone, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care. Welcome back to the Daktari Tone podcast. With me, I'm still with Celestine, an occupational therapist and psychologist. In this segment, we're going to touch more on practice, innovation, and a little bit of understanding on handling children and adolescents. So with that, my first question to you, Celestine, will be, you've spent years working with young people, and even in our first segment, you kept on giving me examples just around handling kids, situations where you even had to have a degree in education, which is still an influence with dealing with children. So in your experience, what are some of the most common struggles that children face, especially those living with ADHD or behavioral disorders? And while you're answering it, please, because for I might be knowing what that is, you can also define in simplest terms what ADHD is and some other behavioral disorders that children face.
Thank you, Kerubo. What I hear you talk about is you'd want me to look at ADHD and other behavioral disorders in children, and what are we looking around there. I would say that ADHD in full is attention hyperactive deficit disorder, and it is one of those very highly diagnosed condition today. And behavioral disorders, we have quite a number. We can have what we call oppositional defiance disorder. How do you differentiate these two? As the name says it, attention deficit hyperactive disorder is clearly somebody struggling, or a child struggling with attention hyperactivity disorder will have inattentiveness, like they're in class, they can't do 45 minutes, they will do less. They will blurt out in class before a teacher finishes asking questions. They'll finish sentences for you. Some of them are quite energetic, they're jumping up and down. And at times they may go unseen because, especially if they're boys, the myth is boys are active. And probably this boy is more active than what an ordinary boy should be. Then how do you differentiate that with maybe behavioral disorder? So oppositional defiance disorder is selective. They will defy certain orders and they have issues with authority. So that's the distinct. It's selective.
Yeah.
But with ADHD, it's across board. So where does ADHD start from? What ordinarily today people are talking of neurodivergence, neurodivergent developmental disorder, is because of the diverse ways of the way they live and act and behave around doing things. So currently we also have what we call, there are people who are born with ADHD. Then we now have acquired ADHD, which we are calling technological ADHD, which is now and more, we are seeing it showing more in children, and even you find people above the age of 30 being diagnosed now as ADHD. A majority are acquired ADHD symptoms. The ones who are born with ADHD, you see it from childhood. They struggle from childhood. And that notwithstanding, we also have those that trigger technologically at childhood. And when you're talking of ADHD, we also would not, separate it from what we call autism. So you find today the technology is good, the screen is good, but we have mishandled it as the third babysitter. So you find parents, when you give children the phone, they will not disturb you. So you're at peace. They've sat there for 3 hours. They've not disturbed you. You've done everything in the house, but at the expense of awaiting medical bills and a non-functional child. So how do that present? Most of the children are coming up with delayed communication speech. And you may have found children who talk with foreign accents to the oblivion of parents. They are like proud, my child can talk like an American, but it's not an interactive communication. Now that's acquired. The one which is not acquired, they may develop speech at the right time or not. And of course they talk fast-paced. Sleep is an issue, especially on the acquired. Irritability. Theirs is more distinct with irritability, while the natural, inherited, or born with have impulsivity. Acquired has irritability. You withdraw the phone, the tantrums are real.
Yeah.
And as such, it has affected the performance across board, from the classroom to workplace.
Hey. The fact that you've mentioned workplace, I'm now rethinking myself. I'm like, wait, I've seen older people having tantrums. So, okay. Woof. Now, on that same breath, we have children, adolescents, babies from newborn, because we've also, with your explanation, it can start from birth, of course, and it will even be seen with when they're growing up. So for parents and teachers, you will find that for most of them will just misread this or maybe misinterpret it, or certain behavior. So how can adults better understand what a child is communicating through their behavior, or what are those key, I don't know if it's right to call them symptoms, to know that this child is normal? I don't know if that's a right one to use, because I don't know if it's abnormality. I'm not quite sure at this point. But then, to just know that this child may be suffering from, ADHD, or the technology. There's also the technology, the acquired one, or the other one. There's another third. I think you've given me 3. Yes. So how can parents and teachers, be able to tell that a child is, maybe acting differently or not as they should?
Okay. Thank you for asking about that, because if you don't understand it, you will not, because there's still a lot of advocacy and awareness that needs to be done around that, especially in early child development, because it's an easier way to parent without sweat if you're using the phone. In a newborn, the child we have what we call the primitive reflexes that children are born with. And as you test those reflexes, there are some that may not exhibit at that particular time. And there are like 6 of them. And normally, I know places like Kenyatta National Hospital, there's an occupational therapist who does the early child identification for any child who could be at risk of developing developmental challenges. So when they see the child may have a high risk, they will tell the parents, please come back. When you come back for the 6 weeks clinic, please pass by occupational therapy again for us to follow up so that early intervention starts. So that was put in place in 2018, so that 2018 or 2015, so that we could be able to start intervention as early as possible. For a mother, if let's say you got your child in a facility that there's no occupational therapy newborn units, is your child in breastfeeding may not hold on to the breast well. When they don't attach, they keep crying, they don't even have sleep. They don't sleep. A child who is awake 48 hours, it's good to ask if it's not probably the discomforts of the early childhood, the stomach problems, the colics, then probably get a professional to be able to check out on the child. Then they don't like being held. They want to be left lying on the cradle with nobody holding them because they have hypersensitivity to touch. They don't like hugging. Just leave them on the couch, they're okay. Hold them, they scream. They don't like shawls. And you see, with the newborn, parents want to hold them in shawls. So that you will realize that's born with, because it's also running genetically in some families. Then, of course, this child may developing their milestones like the walking, the crawling, they will. And at times they're faster than children of the same age because they're very high functioning ADHD. So they may even talk fluently by the age of 13 months, 14 months, and everybody goes like, what? They walk by 9, 10, 11 months, they're walking independently. They're very fast, faster than their age mates. So what does that tell us? That in every stage, as you visit the hospital, it's good to visit an occupational therapist to monitor your child development. And so when ADHD progresses into a classroom setting, in most cases, they are normally singled out like naughty children. So they're punished a lot. And at times, children, teachers may not have the knowledge. These days is a bit better. We have more trained special needs teachers than we used to. But not every school, every class may have a teacher who would be able to. And being that we're academically very focused country in terms of our learning, but I love CBC, the little I've been following of it, is you'll find that so long as a child is performing, the other things may be ignored because they're exceeding expectation.
Yes.
Ironically, children with ADHD are also very, very intelligent in class, completely high functioning. The two go together. But again, they're very fidgety, they're very impulsive. The teacher asks a question, they will not let another child answer, they're blurting the answer out, they're finishing the statement for the teacher. There's a way they relate. They will always lose things. If you're a parent, you'll notice today they'll come without their diary. Also, you have to work with the teacher that the diary should be packed. They will come without their pen. They will come without one shoe. I know of a parent who shared how the son came home with only the swimming costume because he even lost his shorts. So they're always losing one thing or another. They don't give attention to detail. So that's where a parent will also start, this is not usual. So what do? We need to start working on structure. Then in oppositional defiance, you'll realize it's quite selective, and the teachers may be able to notice that they do not work well with authority. They defy authority. And at that point in time, then that's why we have, as we've progressed over years, we have occupational therapists in schools. And then, of course, we also are asking if we could have more teachers with special needs education will also help to support these children holistically.
Yeah. Whew, okay, that's still a handful. I'm also learning a lot. And now, with all that, what are those interventions or approaches that you have found to be most effective when handling, maybe children who are struggling with ADHD or yeah?
One of the things that I find working well is the parents working with school and occupational therapists, a team, because everybody have their role, but concerted effort in every area so that we are not inconsistent with the kind of feedback we are giving the child. Have a structure of their sleeping time, play time, less screen time, interactive. There's a way of correcting them. Don't talk over them. Talk with them. Give them an eye contact. Stop doing what you're doing and turn and say, Kerubo, I'm talking to you. I'm saying, let's clear our mess now. We've played, let's clear. And you get firm. Kerubo, please, let's pick your toys. So that they also learn to have a structure. Do not disrupt that structure. If you've put it that in the morning when we wake up, the first thing we will do is probably sit on bed, go to the washroom, wash your face, sit on the table. They have problems with transition. So if you change that structure, then the transition is upset. So you find that every morning before they go to the school bus, they're crying if you keep changing the structure. Be consistent with the structure you have.
It's more like routine.
Routine. And even their homework. What have you put in place for them to do their homework? What other activities have you put? Like for me, I encourage parents, if possible, get storybooks that are stimulating. Read for them so that you're training listening skills, attentiveness, you're reducing concentration. Do beadwork with your children. Do a lot of puzzles. They're trying to find it. They're learning. You're reducing hyperactivity. You're increasing attention span. You're increasing learning. So it's a play, but it's therapeutic. Yes.
So with now that whole approach and angle of how you could handle maybe a struggling child with ADHD, we do know that there's age. It goes with age. Does it start from them being outrightly now growing from newborn all through, and then they've joined school or they're with their peers? At what age? Because I feel, I'm not quite sure that with age things can change, or with age also it can come up, because you also said that those that are born with and those that are acquired. So how do you handle how can that be handled with different age sets?
Okay, thank you. Okay, we have talked about the early child development and how ADHD presents itself. How do we get them to school as they play? Then as they continue progressing in age and developing, it doesn't mean that ADHD is cured.
Can it be cured before you continue?
No. What we cure is the acquired. Because it was influenced by an external cause, as opposed to the one you're born with. Among them is that would also confuse parents is a child with ADHD is very confident. They can address 1,000 people and they're only 4 or 5 years old and say a poem, thank you, and they don't feel shy about it. As they grow older, by the time they reach about 8 years or so, then you find they start being shy. Then everybody's asking, that intelligent child,
What happened?
that child was a good performer. What changed? They get more quiet now. But that is because now they're getting into adolescence, they're getting into early puberty, there's change of hormones, and the ADHD is kicking in, so the brain is on a race. So it's at that time, remember, everybody has criticized them. You can't stay still, you can't do any work, you're so mannerless when you're talking. They take all these criticisms and then it's at that point it delves to them, and they live with low self-esteem. And nobody can comprehend that once upon a time, confident child is losing confidence at 10 years. More shy, more anxious, feeling very segregated, because everybody is talking about you're talking too much or everything. So they're closing in, nobody really likes me. So as they keep on growing, they want to be in their own space. And then it's at that time, at around the age of 10, 11, 12, they can't handle it. A majority now starts looking at what would be the alternative ways of coping with what I'm feeling. So remember, that time probably medication hasn't come in. They're not aware they have ADHD, neither do the parents know. So what happens? I want to be alone in the room. I want to stay alone. They feel I don't want to, everything doesn't make sense for them. So at that age of around 11, 12, 13, people do not differentiate how ADHD behavior presents. The hyperactivity could have gone down. However, now it kicks in like depression, and people think they have bipolar. So unless you're very clinically very keen, but you may mistake somebody struggling with ADHD to bipolar. So when they reach early adolescence, they will go for self-medication. Self-medication is when they're taking now substance use disorder. Peers will try you out on cannabis, and you feel, wow, I'm able to sleep, because of course cannabis is giving you some gratification. So you'll find most of them end up being substance use abusers at an early age, but it's because they're self-medicating. So it's at that time you're struggling with them in rehab or wherever, and you realize they started self-medicating long time ago and they're better. So some would go the route of self-medicating. But if they are more self-aware in early adolescence, then you will have gotten a professional, an occupational therapist, a psychologist, a psychiatrist, who will have given you the right diagnosis. And yes. So later in life, they may have families and they struggle with taking care of children. So if it is a woman, they can't run the house morning to evening. If it's a man, they can't be able to sustain the family activities. They get exhausted. Now that hyperactivity turns to something of less activity. Hypersexuality is also another thing, because that action, intimacy, produces high dopamine, which helps to feel relaxed. And the list continues.
The fact that this can work with you up to when you're older, and now you get to find ways to, I don't know if it's survive, cope. And they may be healthy, they might be unhealthy, they may be, God.
Yeah, so in most cases, people think they're delinquents because of the kind of things they do, but it's just the way they're responding to how the society has handled the feedback of their behavior.
Since childhood or
What I'm also seeing presenting a lot of late, I'm yet to understand, is their interaction with ice cream. Most ADHD persons I've met, I think the nth person can take a liter of ice cream tumbler alone in a day. I don't know what's in ice cream. We're yet to get there. But I've found like nth person.
Okay, this is totally, I'm learning. I think I'll also research what's in ice cream. You've just said that, I was like, wait, what? I just had ice cream yesterday night. I was like, okay. But then it's not 1 liter though.
Yeah, they do a liter unapologetically and irritated if you call them out.
Whew, okay. Maybe if I was to think for them, I would say for the ones who are going for cannabis, which, maybe if I'm aware that that's a drug, I will be like, let me go for ice cream, which is not judged. Maybe, I don't know. I might be wrong too. Because, ice cream, if I tell you I'm taking ice cream, you won't think of me being a substance user or abuser. But if I say cannabis, you're like, huh? She's using, right? Or even the others that are coming up now, hey, the way technology is coming with newer things and newer drugs, or maybe they were older but now they're becoming more, we are now aware that they're existing. So I feel like maybe ice cream is the harmless cannabis for them.
Probably the sugar, the cracking of the ice in it, because they also have what we call the tactile feeling. So probably as the oral feeling of it, as they're cracking the ice or something, is something that also gives them gratification. But they can do still ice cream and the cannabis. It doesn't mean that one replaces the other. Yeah. Or alcohol, whatever they use as self-medication, many things. I have experienced quite young children now going for, what do you call it? There's this new drug they like. What do you call this thing they smoke? Is it okay? Vape. Shisha is
Vape. Hey, wait. Fancy cigarettes. Okay. All right. Okay, now you've mentioned something also that is really important. The fact that it cannot be treated. But then what are as much as it cannot be treated, it can be managed. Right? So, we've talked about how they do self-medicate. So you as the expert, the practitioner, how do we get now to manage, especially now when I might have grown with it and I don't even know it's sourced from me being younger, because, if something that I'm certain a large number don't even know that it's something they acquired when they were younger or they were born with, and it was mismanaged, or now it was shut, now they found more other ways to cope. So what are ways to manage it, as much as for those especially which it was not acquired? How can we manage?
Okay, just to maybe probably put this in perspective, it's not that it cannot be treated. It cannot go away if you're born with it.
Oh, yes.
It can be controlled through treatment. And so what you're asking as a follow-up is, if you didn't know you had it as a child and now you're older, then how do we manage you as an older person? There are medications. First of all is acceptance. Accepting, being aware that I have ADHD and I accept that I do have it. So how does it present? How do I notice my triggers? How do I deal with them? How do I avoid them? Managing. It doesn't mean with ADHD you can't function. It doesn't mean with ADHD you can't reach the maximum of what you want to do. You will reach your optimum. Be aware, manage yourself, control, and as you're managing yourself, look at what triggers me. If I do this, what happens to me? What are the results? So, and no one ADHD presentation is the same with the other.
Yeah.
So do not copy somebody else's structure. They can share that for me to wind down, I do this. Works for them, but what works for you? So it's very individualized.
Which also scares me. I don't know if that should make me feel better. Although it also scares me for you, because again, you being the expert now, today you're handling Rianne, who has a different structure. And now tomorrow you have to meet, my second name is Hillary, so now you have to meet a Hillary who now you can't use the same structure. You have to figure out a structure for them. I feel like that is super tasking.
For us as the therapists working with the clients, I think over years, because it's something we are used to, and we've got to kind of understand your setting, your personality as a person, your environment, your career, your support system, then it flows.
Yeah. Okay. On ADHD, if I'll have more questions, I'll ask. But I feel like this is a whole... we should just set a whole discussion around it, because I feel like there's something's that are just... I'm like, wait, what? Okay. So now you also work with gifted children.
Yes.
Yeah. So what unique challenges do they face? And in this term, please define gifted. To just make it out there clearly what gifted means, because there's a place where there's a time. This is me being humorous now. I hope I'll be humorous enough. So there's a time someone told me you're really special to me. I told them don't use that word with me. I don't want to be called special. I am not special. Yes. So yes. Now, when working with gifted children, what unique challenges do they face?
Okay, gifted children have different acumens that they express or they display. And when we are talking of gifted children is completely high achievers above the level of their age and expected within a society.
This is like IQ?
Some is IQ. Some are gifted in terms of artistical work, dancing, art in general.
Oh, yes, I get it.
And some very intellectual. How do we identify them? We actually identify them in early years if they're taken to a professional. You measure within their expected developmental age and their functioning age. However, does our society have room for them?
Yeah, I get it.
Does our education system have an opportunity for them? It is quite systematic that they've got to go through it. There was a boy from Nyeri, I guess, was barely 10 years and would repair radios and TVs and everything.
Yes,
Where did he go? Where did he go?
There's even another one I saw who made even a whole matatu, but a small one, but it really looks so good. Like almost like oh my God.
What about the boy who would listen to news for 10 minutes and then recant every word? What did we do with that boy? Where did we take him? What happened? Of course, they get bored very fast and then they leave it out. So what happens is you work within the means that are available and be able to relate with the school, talk to the school and tell the school, this is what this child is. If they are finishing their work that they're supposed to finish in 1 hour, they finish in 15 minutes. Please let them help you out in class. Let them walk around to see who is making noise so that you're introducing an aspect of leadership and control.
But then, hold on. There are very many schools around. Like even in Kenya, if you just have to count how many schools are that, you've given a great advice where you talk to the school before you even get to understand. And within the school, there's still a large population or a number or a handful of population before you even get to now figure out that this child is gifted or is more gets to work better in a certain area, art or any other, excels in something more. Who is this to talk to the schools, and how do we even get to now fetch? Do we have groups, or because the way you're saying talk to a school, I'm seeing you talk to a school. And I'm now we have so many schools, we have so many students, so many pupils. So before we get there, who does the talking?
I think the human resource in terms of education and gifted children is very limited in our country in terms of the numbers of people with that professional acumen to do that. And for that reason, yes, you only handle the children who've been identified and reach on your desk. What about the ones who are out there? Who is fishing them out? Nobody. However, you'd hear parents say this, but I think it's more of more advocacy, more awareness to be done in that area. And I know KISA is doing something, but of course, again, with limitations due to resources. But there is something happening somehow, somewhere. Gifted and talented children. Yes.
Okay. So what can schools do better to support neurodiverse learners?
Wow. One is, the beauty about it is there are many more organizations. There are many more organizations that are working with neurodiverse children or adults. And there's a lot of concerted effort in terms of support in these areas in schools. But the schools would actually work well with support teachers support teachers so that these children learn in the same environment, school with the other children, have a tailored program for this child. Like, I'll tell teachers, if after 30 minutes, please let this student walk out. Tell them to go and get water and drink. Tell them to go just walk on the corridor and back to class. Just that movement and change of position helps them to get back to starting again. But if you want to do 45 minutes lesson, 40 minutes lesson, then the next lesson, and then you lose them. Actually, majority of children with neurodiversity who are learners, you lose them in the first 20 minutes. Most of them, you lose them in the first 20 minutes. But as we're talking of ADHD, we also have a severe neurodiverse condition, which is autism. Yes.
Okay. Now, prior, you had talked about you starting, I can't remember the term you used, but how I understood it, where you've started including children, but then there was a class which was separated from the other students or pupils. And now, with that thought, what do you feel like are still some barriers that we still face in achieving real inclusion today, other than that which you now mentioned that you've been working, and has it taken up, or?
Okay. Yeah, I trust that a majority of people who started off the inclusion movement around in the country are aware that we are talking of inclusion from family level to national level. And that's why we are talking of, if somebody, let me give it as simple as this. If somebody using a wheelchair today would visit Daktari online and the lifts are not working, will they get to your office? No. It should be as an automatic as if we have a washroom, anybody can use it without second guessing that there was provision for wheelchair use. That's what we call, we've attained 100% inclusion, which is hard to attain 100%. So what are some of the things that are making us not achieve inclusion? Infrastructure. Trained personnel to be able to implement these things. Operationalizing the policies. We have very good policies as a country. We have, how do we operationalize them? Visit the medical centers, visit hospitals. I will not mention any hospital by name now. And ask if today a patient with hearing impairment or deaf patient for that matter, would you be able to see them without getting somebody who is interpreting and infringing on the confidentiality of this patient? You want them to write down so that you talk, and are you getting the real thing? You cannot do sign language. Yet we're talking of inclusion. So there are skills that we need to make like almost universally available. Yes.
Okay. Now, I still feel like this segment has introduced so very many topics that we will delve in future. I really hope you'll come back again, because I still want to learn more about that. We've mentioned autism, I still want to learn more about that. And even more on ADHD especially. That one has caught me. I'm having a lot of questions. I'm like, wait, what?
Yeah, visit us. And then we do a screening on you.
Yes, and now, with that, you've done a really commendable job to, fight for those who cannot fight for themselves. I believe that's the right way I can put that.
The voice of the voiceless.
Yes, because so you're asking the right questions and the good questions, and I know deep within with you asking those questions, you've also tried to advocate and even be a solution to them, other than just being the one asking them without necessarily doing something about it. And that really, again, I'll say again and again, says a lot about you. So that will come to an end of this session because again it's still much handful like just the first one. I don't think it's getting any easier. But before we do that, again I have a set of questions for you, but I also want you to start now. You can ask me a question first and then I'll ask you my questions. Do you have a question for me?
Yes, Keruba, I have a question for you. You've talked about you'd want us to look at ADHD further than this, and you're actually like, oh, okay, you're second guessing. What is it? What's your observation, whether in your workplace or your social settings, how people interact with their phones? And how do you think that would also interrupt their communication in terms of physical being?
Yes, that's a very good question. And people, I think people carry this like everywhere. Almost to the loo, everywhere they sleep, before they sleep. When they wake up is the first thing they check. Everywhere. And for me personally, if you had known me earlier, mostly I always tell people I'm just a fake Gen Z because I'm not always on phone that much. But then when also I am, I will be. But then it wouldn't be that much. I really get time to put it down and interact with people. But then again, with the current, not to answer your question, with the current era we are in, you find that this, as much as we carry it everywhere, it's almost everything. It's like almost our handbag, our office. That's where you will have your office documents. If you want to check something, it's there. Also, we've now stopped having physical games. You know, the way and which I feel like also in advocating for it, including children to play physical games, not just phone games. Now we're even having those games incorporated in phones. So if I even think of a hobby, I find it on my phone. If I want to go play pool, I can download a pool game and play it here. If I want to play Sudoku, if I want to play Scrabble, and I feel like that is just having us putting our eggs in one device, which can also be very, not can be, but it is very not healthy. And I believe studies are still done around it, but believe me, you just having everything in one device, the only thing that you cannot do with it is eat and go to the loo and sleep. It's scary. Actually, it is very scary.
100% what you think is life. And that makes me thinking, how would you function in a day you don't have your phone with you and you're out of the house?
Yeah.
Would you function?
Yeah, for me, I will function. I grace myself to ever been put in a position where for almost 4 months, I didn't have a phone. I didn't have a television with me. I only had a radio, which I got so used to the music that I was listening to until I stopped. So for all those 4 months, I was just cut off the world. I even remember telling my dad, I was telling my dad at that time, telling him that, you know what, ata Kenya ikiuzwa, I would never know. Until now, the 4th month, it's when it started affecting me because now I wanted to reach out to my friends. I even remember my friends were like, are you dead or something? Because for 4 months you've been MIA. But then it helped me. It helped me to know how to live without the gadget. And sometimes even within my week, because you see, my job, my job, mostly you'll have to handle a device. If it's not your phone, a computer. If not your computer, the television. If not the television, the cameras, which is still lights everywhere. So I've incorporated a pattern in my life where within the week, I'm just off gadgets.
Sanitize
and actually, I go to nature. I'll go even to just a grass field and just sit.
That's how you wind down?
Yes, and just put my phone aside. I don't care. I won't, even if you call me, I won't pick up that phone. I am sorry, I won't. I'll have to look for you the following day or the day when I'm now back to reset to now being a corporate person. But other than that, I'm off.
Wow, listening to you, that tells me you've set very, very defined boundaries on your interaction with the phone. When I ask that question in most forums, people say that I can't get my bearing without my phone. We've made it part and parcel of our lives, which is not bad. But what we need to do is to set boundaries and be able to say, I'm gadget free from 9 p.m. I'll deal with it tomorrow. You're not an emergency unit.
And even other than just being gadget free, something else maybe that I would also want to add on that. Sometimes, other than just having the gadget, we have the ones that are you can be offline and still use, which you can get bored of. But then the ones that you have to be online, which is now the social media platforms. For me, I've also set a boundary where I can just be off socials. Like, as much as, yes, I can have my gadget, I am not consuming any social whatsoever. And even people keep on asking me, you're in the media and you don't even know what's in the news. And I'm like, it's healthy for me. I don't have to know everything. Exactly. And even sometimes news is overwhelming. And it can be. So I just cut off.
There's the fear of missing out, and the gadgets aren't bad. Yeah. Let's not demonize the gadgets. It's only how do we interact with the gadgets. Are we aware when the gadget is taking over my life and I'm unable to control it?
Reminds me of a statement when you said, "Bad, do not demonize the gadget." There's a line someone said, when a gun is seated on the table, it's not harmful until it's on someone's hand.
Exactly. It's the same thing with the gadget.
Okay, so I'll ask my question as we wrap up. And the question is, do you ever catch yourself applying occupational therapy or psychology lessons in your day-to-day life? E.g., with a child, friend, or even yourself?
Many times. We are told that when a shoemaker or a cobbler walks on the streets, looks at how the shoes look. A tailor looks at your fabric and your fashion. The psychology in me and the occupational therapy in me does the same. And wherever I look at children playing, I actually analyze their behavior. Are they within the parameters of acceptable social behavior? Wherever I'm even with my family, I'm not quick to judge. I always ask myself, what are you processing that you're throwing a tantrum that doesn't really, I don't see where this tantrum is coming from. Yeah. And yes, it influences a lot. Even when I'm dealing with the people I work around with, I'm not quick at punishing. Before understanding where you're coming from, because at times you could be handling a colleague who probably is undergoing some social things. If that's not what Kerubo has been, what has changed Kerubo now? What is it that Kerubo is going through? And then, of course, working a lot with confidentiality. I've seen that people feel quite easy to approach me if I ask them, but what's going on in your life? You don't seem happy today. At times it's good to check in on each other, even as colleagues, and also be able to respect people's boundaries, because mental health is real. We've stopped caring about people and we care about things. Yep.
But that's it for this segment. In the next segment, we're going to touch on leadership, policy, and being a CEO of Oasis Mental Health Hospital, right? Yes. To catch that, see you next.